Bill was, like I said, $2,200.
On Saturday, Woss resident Nigel Poulton told CHEK News the Island Health Transportation Program, designed to get rural residents to larger centres for specialist medical appointments, was flawed.
We're trying to save you money.
He'd suggested to save money, a volunteer could drive him down the roughly 395 kilometers to Victoria at the government rate of mileage, about 61 cents a kilometre, a total of $488 round trip. But Island Health said no. Instead, they sent a cab, costing more than $2,200.
If someone's willing to have a friend drive them down or a volunteer drive them down, pay their mileage.
It's a sentiment BC's Premier said today that the health authority should be more open to.
Sometimes bureaucracies like health authorities have very rigid rules that don't accommodate the nuances for an individual situation. And I hope the health authority has a look at it to see if there's some savings.
Previously, Island Health told CHEK News that travel assistance is for those who don't have any way to travel out of community for medical appointments, saying it's not a reimbursement program for people who have friends and family who are willing to drive them.
They're inadequate.
Paul Adams, Executive Director of the BC Rural Health Network, says the health authority's failure to think creatively is needlessly burdening the system.
The only alternative is to provide you something which is 4 or 5 times the cost. That doesn't make a lot of sense for the taxpayer.
Researchers who study rural access to health care say Canadians living in remote regions aren't receiving the health care they legally should.
This is a really significant issue where your postal code really does, to a large degree, determine access to care. And that's contrary to what we're aiming for in our publicly funded healthcare system.
CHEK News reached out to Island Health for a response, but did not hear back by deadline.